Hi, Dr. Brenner. Thanks so much for talking to us today. One of the things that we're really interested in is your work that you've done through the Camden Healthcare Coalition with Northgate II, which is one of the senior housing properties in Camden that you identified early on in your work as a hotspotting community. Could you talk a little bit about why you really were interested in working with housing properties and its staff rather than just trying to find these individuals and elderly and other residents on their own?
Very early in our work, we started with collecting claims data from the three local hospitals. We mapped that data out, and we pretty quickly learned that costs in Camden and healthcare utilization was highly concentrated in geographic patterns. That in Camden, our highest cost, most complex patients, many of them are collected up into specific buildings. And Northgate 2 popped out very early on as one of those buildings. Most of the patients in the building have cards. They have Medicaid and Medicare, often have both. So this is not a problem of coverage. This is a problem of access and how we've constructed our healthcare system. They have a problem getting to offices. They have a problem making appointments. The Medicaid transportation system doesn't work well. When they do get to the office, the doctors run in and run out of the room in very short visits, and the patients often don't have care in their own language and may not understand what the providers are saying to them. So when they get to the hospital, no one explains anything to them. Lots of different doctors come to the bedside. All their meds get changed. They get discharged out of the hospital fairly bewildered by what had happened. It's interesting also that we've had a chance now to map claims data in Trenton, New Jersey, Newark, New Jersey, in Howard County, Maryland, in 3 counties in the state of Maine, 9 counties in Northwest New Jersey. And everywhere we've looked, whether it's rural, suburban, urban, poor, wealthy, we collect high-cost patients up into specific patterns. They get collected up into buildings, and we can use these things as actionable strategies to figure out how to better serve their needs.